The early days of mental health treatment was nothing short of horrific, sickening, and downright abusive. Patients who deserved kindness and respect were treated with electroshock therapy, forced drugging, extreme isolation, and lobotomies. The earliest purpose of asylums was never to treat or cure, but to lock those insane away from normal society. Benjamin Rush, considered the father of American psychiatry, was the first to abandon the idea that insanity was caused by demons. But he still purged, vomited, and bled his patients, believing that the fluids in the body were out of balance. When the Illinois Asylum for the Incurable Insane opened its doors in 1902, it truly stood out from the rest. Wanting to stray away from those traditional methods, local surgeon Dr. George Zeller changed the name of the game when he was appointed as the first superintendent. What started off as patients being locked behind bars and transported with chains was quickly reformed into a safe haven for mental illness treatment. One of the first things he did was quickly petition for a name change. First called the Illinois General Hospital, and later changed to the Peoria State Hospital, as he believed nobody was incurable. He had compassion and respect for his patients and encouraged his employees to do the same. He established a nursing college on site, adapted a healthy diet for the patients, and did away with the use of narcotic drugs. Now, he left the institute for a 6-year period. Upon his return, he was absolutely shocked at the state of the hospital. His employees had no idea he actually checked himself in as a patient for 3 days to evaluate the conditions. Now, when George retired in 1935, and even after his death in 1938, the place continued to run humanely. They hosted movie nights and dances, and even had Barnum and Bailey set up a circus on the grounds in the 1940s. During its peak in the 1950s, it housed around 2,800 patients. When state funding was cut, employees were cut, which went from 1 nurse for every 2 patients to 1 nurse for 60 patients. When it closed after 75 years of operation, it only housed around 600 patients. Now, in the cemetery on the property, there is around 4,100 people buried there, most of which died from tuberculosis, pellagra, or simply just old age. Now, some of the graves are only numbered, so why is that? They did that simply for privacy reasons, as some families did not want to be known as having a relative in a mental asylum.